Hi, thank you so much for giving us the gift of your time. And Randy Schrupp, thank you for doing the same thing. Let me introduce you, sir. Randy has been helping seniors with their insurance needs since 2007. His core focus in Medicare plans and long-term care insurance is weighted by his giving and caring heart. So thanks for coming to the table and sitting with us and before this microphone and giving up your time today. Let me start here, Randy. You've been doing this for no small amount of time now. Mm-hmm. What would you say is the difference between Medicare supplements and Medicare Advantage?
The Medicare system was basically created by Congress in 4 different parts. Part A and B were the first section that was passed in 1965, okay?
I don't think I knew it was that long ago.
Oh, yeah.
Okay.
And then 1985, Part C of Medicare was passed, and I'll explain more about those parts later. And then in 2006, Part D of Medicare was passed. So it came in 4 parts. The original 2 parts, basically, the plans were designed to have the beneficiaries, the folks like you and me who use Medicare for their health coverage, they wanted all of us to share in the cost of our care because otherwise there's a tendency to overutilize the benefits. And they said, we'll never be able to afford this if everyone's running to the doctor without taking 2 aspirin first. So they had these deductibles, co-insurance, and co-pays that we would have to pay each time that we went and got some sort of care. Obviously, the biggest one was if you went into the hospital, okay, but even a doctor visit. The problem was the Congress never put in what we call a maximum out-of-pocket or a stop-loss into original Medicare where, all right, if you've paid $5,000 out of your own pocket, then for the rest of the year, we'll cover it all, okay? And so then we call that a MOOP, a maximum out-of-pocket. So there was no MOOP, and private insurance companies said, well, we'd step in and kind of fill that gap for people who are concerned if they get terribly ill about running up $10,000, $15,000 worth of personal cost. So they started selling Medicare supplement plans that are also called Medigap plans. The key always was you get Medicare Part A and B, you use your red, white, and blue Medicare card, and then you use your supplement. And those plans basically between the 2 payers, the primary payer Medicare and the secondary, they cover pretty much everything. Medicare Advantage plans came along in 1985. That was Part C of Medicare. And what they were was introducing the private enterprise into the Medicare system. So these private insurance companies like United Healthcare, Aetna, whoever, Cigna, Anthem Blue Cross, they would offer policies which would be subsidized by the federal government. And in other words, if I enroll in a Medicare Advantage plan, the plan that I get, gets paid a monthly stipend from CMS to take care of me. Okay, those plans were a little bit broader. Okay, they can include drug plans at no additional charge and some benefits that Medicare doesn't even cover. So the difference is the one is use original Medicare and a supplement. The other one is it's all together and run by a private insurance company.
You touched on it a little bit, but Randy, what about prescriptions and Medicare?
Prescription coverage is separate, but with a Medicare supplement plan, you buy what we call it a PDP, prescription drug plan, but it can be included in an Advantage plan. We call that an MAPD, Medicare Advantage including prescription drug.
MAPD.
MAPD. Those tend to be the most popular plans. When I started selling in 2007, probably 2 out of 10 people that I wrote went the supplement route. Okay. Now it's probably down to 1 out of 12 or 1 out of 13. The Advantage plans have become very popular because you put all the coverage together in one box. So prescription drug plans are devised to help pay the cost of a beneficiary's prescriptions, not pay at all. So once again, they said we got to have cost sharing, otherwise you'll bankrupt whatever financial system we put up to support this. So in order to accomplish that, they basically did a couple things. First of all, they took all the prescription drugs that are available through Medicare and they get divided into tiers. So an inexpensive drug, like I happen to take levothyroxine for hypoactive thyroid. It's a generic. It's been around for years. It doesn't cost a lot, so I can get that for a $0 copay. A few months back or years back, I had a blood clot in my leg, so I had to take a wonderful new drug called Eliquis. It's pretty damn expensive, like $500-600 a month. That I have a $47 copay. So those tiers were one way to share the cost. Second thing they did was they put in 4 different stages during the course of a year for a drug plan. The first stage is a deductible stage. If you have a deductible, they don't all have a deductible. And then you got to pay 100% of the cost of your medications until you satisfy the deductible. Then you go into initial coverage stage, and that says, all right, now you pay the prescribed copay for whatever tier of drug you have. So that can go from $0 for generic drugs to $47 for brand name drugs to literally $100 or 33% if you get into like major cancer medications that cost $4,000 or $5,000 a pop. You can be paying 33%. They also have the second stage after that, the second or third stage, is called the coverage gap. And once your total cost of your drugs reaches about $4,500 for the year, then you go into that gap. And now instead of these lower copays, $47 for a $600 drug, now you pay 25% of the cost. Okay, so it can go up, and there's a fair number of clients, that will reach what we used to call that the donut hole, the coverage gap. Okay, then it gets a little more expensive. The final stage is called catastrophic, and what happens if you spend about $3,500 out of your own pocket just for medications, then that kicks in, and then the most you'll pay for any one drug is 5% of the cost. That ends on December 31st, and on January 1. It rolls over and starts all over again.
What differentiates the various Advantage plans, Randy?
It's funny. When people look online and on Medicare.gov and everything, they'll see, I think there's 50 or 60 plans available in the center of the St. Louis market. It's really surprisingly how similar they are. Basically, we divide Advantage plans between HMOs, which means you are accepting a network and you agree that the only thing that you'll have insurance for, the only coverage, is when it's provided by a network provider or a network facility. So you've got some limitations, okay? Now you can travel, and if you have an emergency when you travel, literally anywhere in the world, you'll have coverage for an emergency or for urgent care, okay? But when you're around home, you can only go to doctors that are, providers in the network. A PPO allows you to both go in network and out of network, so you have a little more flexibility in choice of providers. The best for having full flexibility in choice of providers is to go back to one of those Medicare supplements, because they're not based on networks. They're just based on any doctor in the United States who accepts Medicare.
Oh, wow.
Yeah.
Okay, so what about Medicare and its funding? Is that ever going to be changed? Is that going to be reduced, or is it ever going to go away? Well,
for years I was watching. Medicare is funded by 2 trusts. One trust, we paid tax into, I started when I was 15 in 1965. I remember my first paycheck, I had $2.35 deducted, and I asked one of the older guys, what's this? Well, that's for health insurance when you get old. And I thought, I'll never see that. Well, I did. So we paid tax into the system, okay? The tax that they estimated we would pay 45% of the expenses of the budget for Medicare through taxes, specific taxes that we paid along with our Social Security taxes. But the other 55% of the budget comes from general revenue funds. So every year that has to be approved and allocated by Congress. You see now some folks talking about, well, we have they call them entitlements. Well, only half of it is half of Medicare is entitlement. The other 45% we paid for, we invested. So depending on how you want to call it, but that 55% has to be granted by Congress every year. They tend to leave it alone because they're scared because us old folks vote, okay? But there's discussions now about doing it. The trusts that were set up where all that money that we paid in taxes that I started in 1965 and I started drawing Social Security in 2015, or Medicare, in 2015. If they draw some of the funding, they could double the amount that I have to pay. All right, so it's tenuous, but so far, most politicians have been afraid to mess with it because it's very, very popular.
It's there, but it's not a given, and it's not a constant.
That is correct.
Gotcha. Is there a concern that you have that we haven't spoken to? I mean, I know we're coming up on fall, and it's time to
open enrollment.
Yeah, how do I think that through? It seems a little overwhelming.
It can be. The best thing you can do is try to find someone you trust. Let me give you an example. This year we have a new, for 2023 plans, which we will start selling October the 15th, there is a new guideline from CMS, which is the federal agency that runs Medicare. We now have to literally tape record all conversations from the minute we meet someone, and we have to identify how we got to meet them, and all the way through until they actually sign an application. That came about because some of the TV commercials that you have been seeing on TV, Joe Namath, some of the other folks, okay, it created a firestorm. Prior to last year, the most complaints that were ever lodged with CMS about misrepresentation of plans was about 16,000. Last year, it was 48,000.
Oh, my.
So CMS said, we've got to do something different. We've got to be able to track the agents and the people that sign these people up to see if they actually are correctly and honestly portraying the plan. So there's some demagoguery, I think that's a fair term, going on within the marketplace.
No.
Yeah.
I'm shocked.
The hard part is you got to try to find someone that's trustworthy. I've made a habit of trying to have personal relationships. I don't do stuff over the phone or over the internet. It's like I want people to meet me and know where they can find me so I can help them if one particular type of service is temporarily denied and they need to make an appeal to get that service, okay, I help with that. If it's a payment issue or whatever else, it's nice to have a advocate, and that's what I do, but that's what I believe you get the best.
Well, what does that consultation look like then? I sit down at the table with you, and what do I do? Tell you this is my age, this is my situation, these are my needs? That's
a good way to start. The fact is, if someone just sits down and tries to tell you about a plan without asking you any questions about, about yourself and generally your health, we shouldn't ask real specific questions, but they can get to know you. I'm a broker. I represent a couple different carriers and probably 15 or 20 different plans, just in Advantage plans and, 8 or 10 Medicare supplement plans and prescription drug plans. You try to match the plan, and the differences aren't that huge. But if you're really good, if you do a good job at it, you match the plan. If someone has hearing loss that's terrible, you're looking for the Medicare Advantage plan that has the best hearing benefit. If they have a real lot of dental problems, some plans have $1,000 worth of dental, other have $2,000. You try to match the needs to the individual. I sell couples, and I always tell them you don't have to do the same plan. If the wife has perfect health and the husband has multiple, he's got diabetes, he's got, congestive heart failure, a bunch of stuff going on. Well, what's right for the wife may not be right for him. And, basically making it personal for each individual.
Randy, if somebody wants to get a hold of you, what's the best way to do that?
I do some advertising in the West News Magazine, which comes out from time to time. They can go online. I'm rebuilding a website. My son works in the business with me, so I'm temporarily down on that. Other than that, I advertise out. You can reach me on phone or via email. You want me to share that?
I would love to hear the
Okay.
email and the phone number.
Okay. The email is fairly simple. It's Randy_Schrupp, and Schrupp is spelled SCHRUPP @MSN.com. That's one way to get me. The other one, I have my cell phone is my business phone, and that is 314-496-0140.
One more time for both.
Randy_, that's the line at the bottom of the empty space, Randy_Schrupp @MSN.com, or 314-496-0140.
In all the best ways, you are old school, sir, and it's nice to know.
Yes, I am.
Randy Schrupp, thank you so much. Randy is kind enough to spend some time with us here today, but he'll do the same for you if you just reach out to him. So, Randy, thanks, and thank you for spending your time with us.